Welcome to A Closer Look. Sexually transmitted infections, or STIs, remain a significant public health concern. Here to tell us what the health department is doing to help prevent STIs is Choya Page, in the bag, Health in a Bag manager.
Yes, that's correct.
Welcome.
Thank you for having me.
So, what is considered an STI, or sexually transmitted infection, as they're called now?
Right. So an STI is an infection that is passed from person to person, usually through some kind of sexual activity. So vaginal, anal, or oral sex. They're very, very common, and a lot of times you don't even know you have one, and that's what makes it so scary and such easily transmitted.
So what are the statistics?
So right now, 1 in 5 people are diagnosed with a sexually transmitted infection, and that is very scary. Over 68 million people nationwide have an STI.
That's just astounding, because you think they've been around for a long time and they're preventable?
100% preventable, yes, and that makes it even scarier.
So why are the numbers on a rise?
So COVID had a lot to do with that. During COVID, we were pulling staff from different areas to take care of COVID investigations, educate people on COVID. And some of those staff members that were pulled were our STD, STI health educators. And so they were pulled off of their regular duties of educating people, bringing people in for treatment, making sure sexual partners were notified, and they were moved over to COVID operations. And this isn't just in the Hampton Roads area. This is nationwide, probably worldwide. And so with them being moved out of their regular duties, STIs were kind of on the back burner. So we weren't really treating for them. We weren't educating people on STIs, and a lot of the clinics that would normally see people were not open.
We're not seeing them.
Right. So you can't diagnose an STI via telehealth.
Right,
You know?
that's so true.
Right.
And it just goes to show you how important education is.
Yes, very much so.
So is there still a stigma, do you think, attached to having a sexually transmitted infection?
Yes, I think there is. I think the word disease, as it used to be called, helped create a stigma. I think there's still a stigma just around sex in general. And so that stigma it grows.
It just continues
Yeah,
to
it continues.
grow. And people may be embarrassed if they suspect something
Yes.
is
wrong.
They
Right.
may not feel comfortable going to their doctor or talking about it.
That's right. And on the flip side, if they don't know, if they're not educated, then they can't recognize those symptoms when they happen.
All right, so tell me what's in the little brown bags and what the health department is doing to help educate the public.
Okay, so first, our Health in the Bag program, and brought a little example for you
And
here.
I see your shirt also
yes,
promotes it.
Absolutely. You will see our logo around town, our brown bag with the condom inside of it. So our bags are made to be very inconspicuous. What we want people to be able to grab these, throw them in their back pocket, throw them in their purse, and just move on. So inside our bag, we have condoms, lube. We have directions on how to properly use a condom, because that is something that a lot of people don't know. And we also have all of the information on our sexual wellness clinics, our STI clinics at the health department, so that people can come in and get tested. They can know for sure they do not have an infection, that they are healthy. And then in addition, we have the contact information for every health department in Hampton Roads, so that if you don't live in Chesapeake or you're out of the Chesapeake area, you can contact another health department and find out if they can do testing for you as well.
So I think you said that there are condoms for both men and women.
There are, yes, and a lot of people don't know that. It's not something that I think is regularly advertised. And so our bags, we have created bags for both. We have regular male condoms. We have bags with non-latex condoms. And then we have female condom bags as well. So we have them labeled so you know which one you can get. And they all have the same thing in them, just the difference between the male condom and the female condom.
So I know you guys will pass them out in the health department, but have you also been out to different places in the community?
We have been out all over Hampton Roads. So we did 3 different Pride events in June, and those were just amazing events, a lot of success in passing out a significant number of condoms at those. We've also been doing a lot of health fairs around the area as well, with our brown bag program and other programs from the health department. And then we have also been going out to local businesses in Chesapeake, and we have been explaining our program, our goal of decreasing the number of STIs in Chesapeake, and, you know, asking and offering to leave a basket at their facility. So, you know, we have a significant number of businesses around Chesapeake where you can walk in, this basket is next to the cash register. You can walk in, you can grab one, you can walk out.
No questions asked.
No questions asked.
Very discreet,
Yes,
very discreet.
Exactly.
So tell me about the department's sexual wellness clinic.
So we have 4 regular scheduled clinics a week. So Monday and Wednesday, we see patients in the afternoon from 12:30 to 3. And on Tuesday and Friday, we see patients in the morning from 8:30 to 10:30. And those are walk-in clinics. We will see as many patients as we possibly can in those time frames, and those will do, those clinics offer screening, health education. We can elicit partners if you have partners that you want to have come in and be tested or treated as well. And, you know, just overall making sure that people are aware of STIs, they know where they can come to get treated, and they feel comfortable going back out.
So the health department is located behind Chesapeake Regional for
It
folks
is.
who are not aware.
That is right.
And you can, I'm sure, go to the Facebook page to find information as well as your website.
Yes, that is correct. So if you want information just on STIs in general and the newest guidelines on treatment, you can go to cdc.gov/STD.
Okay.
And you can get information on all of the different STIs and what treatment is used for each. If you want information on our sexual wellness clinic or in the bag program, you can go to vdh.virginia.gov/Chesapeake and find out more information there.
Great. Well, thanks so much, Toya, for joining me today. It sounds like a great program.
Thank you so much.
Thank you. Well, that does it for this edition of A Closer Look, and we'll see you next time.